As coronavirus has spread across the globe, many have been referring to it as an epidemic. But on March 11th, the World Health Organization took the big step of referring to it as a pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
For a lot of people, this probably didn't come as a surprise. A lot of news outlets were already referring to coronavirus as a pandemic days before the World Health Organization made this decision. The words pandemic and epidemic have been used pretty interchangeably, but words do matter. So what exactly is the difference between a pandemic and an epidemic? The CDC defines an epidemic as an often sudden increase in the number of cases of a disease above what is normally expected in that population area. Examples of an epidemic include the opioid epidemic here in the US, or the SARS epidemic, which killed about 800 people worldwide in 2003. A pandemic, on the other hand, is a much more serious type of epidemic. The CDC defines a pandemic as an epidemic that has spread over several countries or continents, usually affecting a large number of people. Think about the prefix pan, which means all, like a panorama. Examples of pandemics include the medieval Black Death or the HIV and AIDS crisis.
It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death.
Pandemic is not a word that the World Health Organization takes lightly and could be a real game changer in the fight against coronavirus.